Hello, brain shakers. Welcome to today's episode. Excited for this session. In today's session, we are going to be looking at emergency contraception. It is often referred to as morning after, but why is it called morning after? If you know the reason, drop me a comment in the comment section. I would love to know why it is often called morning after. So emergency contraception methods, these are methods that are going to be administered or given or rather taken when there has been an unprotected sexual intercourse encounter. So if you've had unprotected sexual intercourse and then you're not on any form of contraception and you do not want to get pregnant, then that's when you would qualify to then go ahead and take emergency contraception. Now, these emergency contraception, most of the emergency contraceptions that you're going to take, if it is the orals, they will not give you concurrent protection as contraceptive methods. It means that they will work for that particular period, and after that you will have to go on a regular method, which is a method of contraception of your choice. But if you use the intrauterine device, then you may still have contraception even after it has worked as an emergency contraception. Now, having discussed or having made mention of that, what are some of the commonest emergency contraceptive methods? Now, I'm going to be discussing about three commonest methods of emergency contraception. And number one, which is the most effective, and I repeat, the most effective emergency contraception is the copper intrauterine device. Now, I have done a detailed video on intrauterine devices, and you can find that on the Brain Shakers Academy and all the various platforms. And I will also attach a link to help you get through to that video so you can watch and see what an IUD or a copper intrauterine device is. Now, the copper intrauterine device is the most effective form of emergency contraception. And this is a method that can be offered to all women who have had unprotected sexual intercourse and do not want to conceive. So this method is effective even after ovulation has taken place. And this is why we say that it is the most effective form of emergency contraception, because the orals that you would be taking, or the oral emergency contraception, their work is to basically delay ovulation, so that by the time ovulation is happening, the lifespan of the sperms would have already elapsed, and those sperms will no longer be motile and active. So their purpose is to basically delay the entire process of ovulation. Now, if ovulation has already happened, even if you administer those oral emergency contraceptive methods, they will not be effective. But once you have administered the copper intrauterine device, it will still obviously be readily effective. So the copper device can be administered, or rather inserted, 5 days after your first encounter of unprotected sexual intercourse. And after that, if it remains in, then it will still be able to offer you contraception for your next other encounters of unprotected sexual intercourse. Whereas if you are having the orals will not be able to give you protection in your next encounters. You will have to take another dose for the orals in order for you to have protection or a covering from a pregnancy happening. Now, what are the orals or the commonest oral types that you're going to find which are emergency contraceptive methods? Number one, you're going to have ulipristal. Okay, so ulipristal acetate, or UPA, is an emergency contraceptive method which comes, I think, in a dose of about 30 milligrams or so. This is an effective oral contraceptive, or oral emergency contraceptive. I need to specify oral emergency contraceptive because it only gives you emergency contraception and it is not treated as a regular form of contraception. Now, ulipristal can be administered if you've had an unprotected sexual encounter within 5 days. That is 120 hours. So you would still be able to take ulipristal. Now, the ulipristal itself, what happens is that if you have been on a progesterone-based contraception, and then take, for instance, you've been on the pill and then you miss a dose, you take the ulipristal, it may not necessarily be effective because then it is affected by the progesterone element, and then the effectiveness of the emergency contraception may not necessarily be as effective as when administered in somebody who is not taking anything that contains progesterone. But then you also have to be cautious if you are asthmatic and you are being treated by glucocorticoids such as prednisolone, because those also, they tend to reduce the efficacy of the ulipristal drug itself. Now, the ulipristal can be administered, like I made mention, within 5 days of sexual intercourse. So you still have an oral option. If you do not want to go ahead and have the copper intrauterine device, you can go ahead and have an oral a type of emergency contraception, which is the ulipristal. Now, you also have another method which we can refer to, the levonorgestrel. Now, the levonorgestrel comes in various presentations. You have 0.75, the commonest being 1.5 milligrams also. Now, this one is a progesterone based, so it is a hormone based. So the levonorgestrel, what it is going to do is it is going to be effective in delaying the ovulation process, meaning that you can have it administered, and this one is as effective as ulipristal if administered within the first 72 hours. So with the oral contraceptives, they are more effective if you administer the medication as soon as possible. That is the earliest in relation to that unprotected sexual intercourse encounter. So within the first 72 hours, if you administer levonorgestrel, then it will offer you that emergency contraception that you're obviously looking for. It is not as effective as the ulipristal when it is administered after 72 hours. So after 72 hours to 96 hours to about 120 hours, then the chances of you having a pregnancy, if ovulation has happened, are very high, because it is not as effective after 72 hours. So it is mostly effective when administered within the first 72 hours. That is within the first day, second day, and then up to about the third day. If you administer it at 96 hours, 4 days, then chances of pregnancy are very high. And there's also a chance of the effect of the efficacy of the levonorgestrel being affected if your body mass index is above 26. So if your BMI is on the higher side, above 26, then the efficiency of the drug itself is going to be altered. If your weight is above 70 kilos, then you may consider doubling the dose to about 3 milligrams or so to try and then increase the efficacy of the drug because of a higher BMI. The ulipristal and the copper intrauterine device, those are not necessarily affected by the body mass index. So if you've had that medication administered, or if you've had ulipristal administered, then you can wait up to a time of about 5 days before you actually commence or start a contraception. And then if you're having the levonorgestrel medication, you can have the levonorgestrel today and then immediately start the contraception, that is a regular contraception, because like I said, these emergency oral contraceptives, they're not going to give you any protection, any concurrent protection for another episode of unprotected sexual intercourse. It means that you actually have to start on a regular contraceptive method of your choice. You have orals, you have injectables, you have implants, you have contraceptive devices, all those methods to choose from. So you have to go on a regular medication if you do not want to obviously fall pregnant. Now, if you have had the ulipristal, it will still give you about 5 days before you can actually commence on the contraception. Then you would basically go on to contraception. Now, with the ulipristal, a woman who is taking obviously enzyme inducer drugs or enzyme inducers will basically have their effect, or the effect of the ulipristal also being affected. So those are some of the things that you obviously have to discuss with your doctor or your family planning clinic before you can actually go on to these methods. So those are the commonest emergency contraceptives. You have the orals, which is the levonorgestrel, coming in presentation of 0.75 milligrams, 1.5 milligrams, and then you can double the dose if you have a BMI of 26 or weight is above 70 kilos. And then you have the ulipristal, which comes in presentations of about 30 milligrams that you can obviously have administered up to a maximum of about 120 hours, which is basically 5 days. The orals do not work well. They are not as effective once ovulation has happened. So if you know that ovulation has happened, and this also culminates into you having a background understanding of your menstrual cycle. So if ovulation has already happened, the orals are not going to be effective. It means that you now need the recommendation, or you need the administration of a copper intrauterine device, which is going to be as effective. And like I made mention, the copper intrauterine device is the most effective way of emergency contraception. Now, those are your methods. If you found this particular video helpful in understanding some of those methods that you can use after that unprotected sexual intercourse, then go ahead and give it a thumbs up. Drop me comments in the comment section. I would love to hear about experiences, other comments and things that you have obviously heard about emergency contraception, and I would like to know why it is obviously called morning after. Thank you so much for watching, and from me, I will see you in the next one.